I'm waiting for you. You're going live. Go. I should go along yourself. Yes.
Hello everyone, welcome to our live session today. Today we'll be talking about gynecomastia. If any of you have any queries, you can post them in the chat and we'll be able to reply to them. Any queries regarding gynecomastia that you have, you can post all the queries. Till any queries come, let's discuss the commonly asked questions which people want to know about gynecomastia nowadays. So gynecomastia, as you know, is development of female-like breast tissue in the male chest. There are various causes of it. So there are various causes of gynecomastia. Adolescent gynecomastia is the most common cause. Then commonly seen nowadays is the steroid-induced gynecomastia. A lot of professional athletes do steroid injections, the PCT cycles, due to which the glandular gynecomastia is forming. Okay, the gland forms in gynecomastia. There are a lot of supplements which people are doing in the gym. Due to that also, a lot of gynecomastia patients are coming up. So commonly asked questions, let's take a few of them. Is gynecomastia surgery high risk? Gynecomastia surgery is a very simple procedure. We make a small cut inside the nipple area and do first liposuction to remove the fat which is present around the gland and then remove the gland. Okay, the procedure can be easily done under local anesthesia and you can return back home the same day. So not much risk involved. People with higher grade 4, they might be chosen to undergo gynecomastia under general anesthesia, but it's a personal preference of the surgeon and the patient as well. We at Bliniq Cosmetic Surgery Center tend to do all the procedures under local anesthesia only. With some IV sedation, we are able to do all the cases. Okay, so not at all risky. Can gynecomastia be cancerous? There is a very low risk involved with gynecomastia leading to cancer formation. But in majority of the cases, almost 99%, there is no chance of gynecomastia forming malignancy or cancerous tissue. So you can be rest assured that malignancy is not the problem with gynecomastia. Okay, so should I be worried about anesthesia risks, bleeding? No, you don't need to worry about them. There are very minimal chances of anything going haywire. Procedure is very safe. You can undergo the procedure. What is the best age to undergo gynecomastia surgery? For adolescent gynecomastia especially, it tends to form at the age of 13 to 16 years of age, and we want to give you an observation period of around 2 to 3 years for it to resolve on its own. So if the delayed margin we take around 16 years for another 2 years or so. So by age of 18 years, anyone can undergo gynecomastia surgery. If you have had gynecomastia's development at a sooner age, for example 14 years or 15 years, 2-3 years extra, as soon as they complete and the observation time is over, you can undergo the procedure. Does gyno come back after the surgery? Usually it does not. It should not be coming back after the procedure is done by authorized by a plastic surgeon specifically, and your gland was removed in the first sitting, then it should not come back. A few surgeons were initially doing just liposuction and the gland was not being removed. In those patients, we have had a couple of patients coming from other places where liposuction was done, and the gland was not removed, so they undergo the procedure again. So it's very important that the gland removal is done at the time of first surgery only, otherwise the problem, which is gynecomastia, does not get resolved because that lump has to be removed. There is liposuction cannot take out that lump from the chest. Can gyno go away at 25? As I told you, the observation period is for around 2 to 3 years. So the time since you have started noticing that there is a nodule or gland that has formed, which you can feel under the nipple area, and 3 years extra, if it is not gone by then it will not go away. Is gynecomastia due to low testosterone? See, the gland formation is happening due to high levels of estrogen. So we were saying, does gynecomastia due to low testosterone levels? Testosterone levels do affect the formation of gland. It has to be higher estrogen rather than low testosterone, which is the cause of gynecomastia formation. Gynecomastia is basically like your breast tissue. So it forms when the quantity of male hormone, which is estrogen, has increased due to some caused steroid intake, or you are obese. So this estrogen metabolism slows down in your body and its effect increases, leading to gland formation. Can gynecomastia go away with exercise? See, gynecomastia has two components. One is the fat part and one is the gland part. So the fat part definitely can be decreased by your exercises, but the gland which has formed, the nodule or the lump that you feel, that will not go away with exercise. If you have pseudogynecomastia, which a lot of people come with, you can definitely improve the appearance and improve the shape. A lot of YouTube videos are available, which I see. Gynecomastia exercises at home, which are curing the gynecomastia. They are all pseudogynecomastias. So if you do exercise, pseudogynecomastias definitely improve a lot in appearance. That does not mean gynecomastia gets cured at home. If it actually is real gynecomastia, it will not go away. How much does gynecomastia surgery cost in India? It depends on a lot of factors, whether the surgery is being performed in a clinic or a hospital, what sort of a hospital, it's a nursing home or a corporate hospital, and then the surgeon's experience, how many gynecomastia surgeries has your surgeon performed. The ranges can vary from around 40,000 to up to 1,20,000 also, and if your corporate insurances, a few of them cover it, it can go up to 1,50,000 also. So it's a ballpark sort of a figure, depends on where the surgery is being performed, what are the circumstances. So what are the stages of gynecomastia? There are 4 stages mainly. Grade 1 is a small enlargement with no skin excess. Grade 2 is moderate enlargement without skin excess, and then there is grade 3 with moderate enlargement and some skin excess, and then there is grade 4 with the marked enlargement of the glandular tissue and a lot of skin excess, which might need a double incision sort of a surgery. Your skin which is present might need to be removed along with the gland. Okay. Now, how long is gyno surgery recovery? So the recovery period, what happens is that, for example, your surgery was today, this is day 0. So on day 3 you come back, the dressing comes out, there will be no dressing after that. The stitches that we use are dissolvable in nature, so they go away in 2 weeks time. Okay, after that you are told to do some exercises, stretching exercises and some chest massages that you do. Now these massages need to be continued till any of the area where liposuction has been performed becomes slightly tighter. It becomes tough, it becomes hard, so it takes time to become soft again. So till that time you continue your massages. Okay. So this takes around it can take around from 6 weeks to 3 months for your skin to become soft again completely. Okay. You can start driving from the 5th day, 4th to 5th day. Majority people are able to drive. You can join back your workout regime after 3 weeks. That should be good enough. And office we usually allow to join back on the 3rd day only. Okay, so you can do that. Is gynecomastia surgery allowed in army? I have had a few patients which have come after rejection of in medical examination. So they come for the surgery, we do the surgery, and then they reappear for the exam. Okay. So another question will be, how much gland is removed in gynecomastia? I usually prefer to remove all the glandular tissue that is present under the nipple area. We are on removing more amount of glandular tissue rather than leaving some amount. There are a few surgeons who prefer to leave some amount of glandular tissue just under the nipple, a thin layer. So that is also acceptable. Some people might find slightly hard sort of a tissue that way, but we tend to remove the gland completely, so there is no issue as such. Does gyno surgery leave scars? How I do the surgery is that we give a small incision at the just above the upper border of the areola. So that area is dark in itself, so the scar hides very well. A few surgeons do a incision in the armpit or in the side chest area, so that leaves a slight amount of a scar. So we don't do prefer that. We want to do it just through the nipple. So the whole procedure is performed through that. It does not leave any sort of a scar. Once 3 to 6 months have passed by, you won't be able to notice much of a scar in the nipple area. Can gynecomastia be cured without surgery? If you have pseudo gynecomastia, then you can do exercise and that gets resolved. But if you actually have a true gynecomastia, you can feel the nodule, a hard rubbery sort of a mass under the nipple, then it cannot go away with any sort of exercise or home remedy. You have to get it removed surgically only. That is the only solution. So don't waste your time and money trying various medications or homeopathic, they may be allopathic, doesn't matter, it will not go away. Is post gyno surgery painful? Initial 3-4 days can be slightly uncomfortable, but as time passes you are very comfortable. But at the end of almost a week or so, you can join back work from the 3rd day only, so that is not an issue. Majority of the patients are comfortable when the dressing comes off on the 3rd day and they join back the next day, so not much of a problem. There will be altered sensation wherever the liposuction has been done. Some areas might become completely numb, some areas have heightened sensations, so they tend to come back and become normal by the end of 3 months, but you will be very comfortable after the 3rd day. Usually patients are very happy. They stop painkillers also on the 3rd day. Okay. So what does grade 1 gynecomastia look like? Grade 1 is basically some amount of tissue which is present just under the nipple area. It does not cross that margin of areola. So that is your grade 1 gynecomastia with hardly any fat also. That we consider as grade 1. If any of you have any questions, you can ask in the chat. will be able to answer them. Someone is asking, how can I check my gynecomastia at home? Whenever you are examining your chest area, keep your hand flat with the pulp of your fingers. Feel your chest. If you feel any hard tissue, a rubbery sort of a tissue on the chest just under the nipple, then that is a glandular tissue. If it is all soft when you are feeling with the hand, and the pulp of your hand, if you are feeling like this and it's all soft, then there is no gynecomastia. Okay, so there has to be this hard lump which is present under the nipple area when you are feeling it at home. If you have any doubt, you can come over. We can do your examination once and let you know whether you have any gynecomastia or not. Okay. If you don't want to come over, then getting an ultrasound is also a very good option. That's a definitive sort of a test that can tell you whether you have gynecomastia or not. Okay, does milk cause gynecomastia? If nowadays we all are aware that hormones are injected into the cows and the buffaloes to extract more milk. So this might be a surprising cause of gynecomastia nowadays. Okay. What percentages of male in normal population have gyno? The percentage has been described as 55 to 70% prevalence in our normal population as well. Do all men get gynecomastia? No, obviously. There is a very high percentage. Majority of them do experience some sort of a glandular formation at the age of 13 to 16 years. But in majority of them, it gets resolved by the age of 18. Okay, so yes, you can say. What foods reduce gynecomastia? There are a lot of articles available online which say zinc rich foods are helpful, vitamin D rich foods are helpful, or juices are helpful, but nothing has been proven as yet. If it already has formed gynecomastia, then nothing can help you out. Does losing fat reduce gyno? See, gynecomastia has two components. One is the fat part and one is the glandular part, or the breast tissue that is formed. So once you exercise, you reduce the fat component of the gynecomastia. So if you have pseudo gynecomastia, you will be able to normalize it completely. The chest will become completely flat. But if you have normal gynecomastia with some amount of fatty tissue, you will be able to reduce that, but it won't go away completely. Okay, so your true gynecomastia definitely needs a surgery. Exercise will not help you get rid of it completely. We do get a lot of professional athletes or bodybuilders. They lose all the fat, almost 0% fat they come with on the chest area under the skin. And in the last also, there is this nodular sort of a tissue that we can see. They want to get rid of that, as they have to come on the stage, and that is still visible when they flex the pectoral muscles. It looks very odd. What is grade 4 gynecomastia? Grade 4 gynecomastia is a huge amount of glandular tissue along with a lot of saggy skin. In a few patients of grade 4, you might need to remove skin also, or we might need to do a nipple lift. What we do at Bliniq is that we remove all the glandular tissue in the first session. So what we do at Bliniq is that we tend to operate grade 4 gynecomastia in 2 stages. In the first session, we remove all the glandular tissue unless you're very heavy and we expect that the skin cannot go back. We tend to just do your removal in the first session and let the skin contract over a span of next 6 months to 9 months sort of a time, and then we wait for the skin to contract. If it has not contracted in 6 months time, then we take the skin out or do a nipple lift as the situation demands. If the grade is too heavy, your skin has become too loose and it has a lot of stretch marks and I don't expect it to go back, then I remove it completely. What is the difference between gyno and fat? As I told you earlier also, when you feel the area under the nipple, if it with the flat of your hand, if it feels soft, that is just fat. If it feels hard for tissue, then it is gynecomastia, which is true gynecomastia. It is very rubbery, firm sort of feel. You can roll your fingers around it. It feels very rubbery when you feel it. So how do you hide gynecomastia if you don't want to get operated? A lot of patients wear compression vests. They use a nipple tape. They try to exercise and lose weight. They wear loose shirts. They don't take off clothes. These are some of the. So a lot of patients do ask for a areola reduction. You have a nipple and outside that the dark portion, that is called areola. So a lot of patients say that my areola size is very big and they want it to be reduced. But they are explained well in advance that the areola size will shrink once the gynecomastia surgery has been done, all the fat has been removed, the areola tends to shrink. Okay. So we don't do any areola reduction in the first go. Do the surgery, wait for contraction, and then decide. So what are the exercises that you can do to decrease the gynecomastia size? There are a lot of chest exercises people do. You can do rowing machine sort of an exercise, swimming, bench presses, push-ups. These exercises can be tried. Okay. Can I do exercise after gynecomastia surgery? Will the chest definition be okay after the surgery? After gynecomastia surgery, you return back to gym in 3 weeks sort of a time. When we are doing the surgery, we stay over the muscles. There's a pectoral fascia thin layer which is present above the muscle. We don't breach that fascia when we are doing the surgery. Okay. So your muscles build up well when we are finished with the surgery. When you work out after the procedure, if you build up muscles well, your muscles will build up normally, have a normal shape. A lot of patients do ask whether the muscles will build up after the exercise or not. So a lot of professionals do come which have gone to win competitions at state level and national level after undergoing gynecomastia surgery. So you don't need to be worried about that. Is gynecomastia performed under general anesthesia? It's a choice, personal choice of the surgeon and patient. It can be easily performed under local anesthesia as well if your surgeon is comfortable. Is gynecomastia surgery covered under insurance? Majority of the insurances don't cover the surgery under insurance. A few of corporate insurances might be covering it. I have had 3-4 patients in which we have managed to do it under corporate insurance. So it's your luck. You can give it a shot. But majority of the times it gets rejected, normal insurances. Majority of the patients get it done under cash only. Is gynecomastia surgery successful? Yes, it's a very safe procedure with minimal sort of complications. Maximum patients can see some decreased sensation in the nipple area, some seroma formation which can happen under the nipple area. They are managed with aspirations. That's it. Is gynecomastia surgery necessary? Gynecomastia patients usually suffer from low confidence. They are not able to wear tight t-shirts. They are not able to remove their clothes in public places like swimming pool or a public bath, or so they undergo the surgery because of the embarrassment or the low confidence they are facing. Okay, so that is the main reason that they undergo the procedure for. It is not a big issue. You can come to us. So if you don't get the gynecomastia surgery, it is not a big challenge. Okay, you can stay like that also. It will not harm you or cause any sort of cancer or death. It's a completely normal sort of a tissue. For example, if you want to understand it better, it's sort of a breast in a male chest. Okay, so there are a lot of girls roaming around with breasts. They don't die. Okay, so it's that sort of a tissue in your body. It will not do any harm to you. But if you want to improve your appearance, gain your confidence back among your peers, you want to stop that teasing which you might be facing at school or college, you can undergo the procedure. Okay. What are the bad results of gynecomastia? Bad results, I have had done quite a few revision surgeries. So we receive patients who have got just liposuction done and no gland removal was done, so they undergo the procedure. And some patients only gland is removed and no liposuction has been done. So there is this defect under the gadda sort of an appearance, you can say, a hole under the nipple area. When you lift up your arm, you will see that hole under the nipple area. When you put your arm down, then that disappears. But it is a deformity. This is called a saucer deformity. So a liposuction and a gland removal has to be done in every case that to give a good shape. You can notice some asymmetry on both sides due to unequal liposuction. That can also be seen, so that needs to be corrected. In some cases, the skin gets stuck to the underlying muscle, causing a depression there. So you might need to do regular massages to get rid of that. And if that is still not going away, then we can do a subcision. We can inject fat into that area to fill up that sort of a depression if that has occurred. Okay. How long does gynecomastia surgery take? Depends on the grade. Grade 1 hardly takes around 30-40 minutes. Grade 2 can last for around 1 hour 15 minutes. Grade 3 and 4 depends on the amount of fat which is present. They can last from 60 minutes to 90 minutes as well. So it depends. But you will be able to go back home. How long may be the duration of the surgery? We will discharge you in the evening. So that is not an issue. Someone has asked, can I remove gynecomastia myself? No, you cannot. There is no non-surgical method which you will be able to get rid of the gynecomastia. You have to get the surgery done. Be safe, get it done by a doctor at a hospital. Don't try it at home. Can we live with gynecomastia? Definitely you can. If it is not disturbing your confidence, you are not underconfident due to it, you don't feel any sort of shame with it, you can live with it for sure. It is not going to harm you in any way. If it is causing pain, then it is a very big indication that you get it done. If both sides look unequal, that you have only right side gynecomastia or left side gynecomastia, then preferably you should get it done. It looks pretty odd to see. Okay, does ice help gynecomastia? No, it does not help with any gynecomastia treatment. Is gynecomastia surgery safe in India? Very much. It is a very safe surgery. You can get it done in 1 hour and go away in the evening. What are the benefits of gynecomastia surgery? Your muscles get defined very well. Your pectoral muscles as a V shape as we desire in a male chest. You will be able to get that after surgery with a little bit of workout from your side. We do majority of the work for you, remove the fat, but you have to build up the muscles as well. Does gyno come back after the surgery? No, it does not come back once you have removed it. Can I ride bike after gynecomastia surgery? Yes. What is the normal size of gynecomastia. It can vary from 2 centimeter to 5 centimeters. I have seen huge glandular tissues also, around 10 centimeters also. The width, it can occupy the whole pectoral muscle. So there are variations. Will increasing testosterone reduce gynecomastia? No. Once it is formed and 2-3 years have passed by, supplementing testosterone will not cure your gynecomastia. You have to get it removed. Can touching gynecomastia make it worse? Yes, we do get this very commonly. A lot of patients are being teased at schools and colleges by their cousin brothers or sisters, and in school by friends. So it does not increase by touching or playing with it, as some patients ask. It does not. What is formed, it will stay. Does gynecomastia mean low testosterone? Not in all the cases. In adolescent gynecomastia, the imbalance is for a particular phase, months, maximum 1 year, and then it resolves on its own. Few causes like testicular tumors in which testosterone may be low, so you need to get tested. You need to come for examination, a proper examination, then we can decide. Is gynecomastia infertility? No. Unless you have some Klinefelter syndrome sort of a thing, it usually does not mean that you are infertile. If you have gynecomastia, there are a lot of patients who have gynecomastia. It does not cause infertility, or due to infertility you have developed gynecomastia, nothing like that. Do puffy nipples mean I have gynecomastia? Grade 1 sort of a tissue can be present in normal individuals also, causing puffiness with temperature changes. So that sort of gynecomastia can be normal in a few patients. You can work around with it. But if it troubles you too much, they are visible in the t-shirt, then a few people want to get it removed. So you can undergo the procedure. It's a very simple thing. Some patients have very huge nipples, so there is a procedure in which we reduce the nipple size. The lower half of the nipple is cut and removed, and the nipple is put down and it is sutured. So the projection of the nipple goes away. It is not visible when you are wearing a t-shirt anymore. Does after gynecomastia surgery? Yes, it looks. We have the link to our Instagram handle also. You can check that. There are a lot of photos which are present on our Insta handle. Long-term patients, completely normal. We have had a few professional athletes, bodybuilders coming over, so you can check out their photos as well. How do bodybuilders fix gynecomastia? Have any other questions, you can ask or leave them in comments of any other videos. We'll be able to answer that. Our contact number for WhatsApp and call is 7200 You can get in touch with us if you have any queries regarding gynecomastia or any other cosmetic procedure. We do gynecomastia surgery most commonly, and we are dealing in liposuction, breast implants, breast augmentation, breast reduction surgeries. We do hair transplants very commonly. So we can get in touch with us for any cosmetic surgery procedure that you are looking for. Okay, that's it for today. We will be doing these live sessions on Tuesdays and Thursdays starting this week. So for next week we will do liposuction.